The Diep Flap is an acronym that stands for Deep Inferior Epigastric Perforator Flap, which essentially is describing the tissue that is taken to reconstruct the breast. It's a form of autologous reconstruction, which means taking tissue from a woman's own body to make a breast. This tissue is taken from the area that we typically would call the tummy tuck area. In essence, the tummy tuck tissue, skin and fat, is removed, but unlike a more conventional tram flap, where TRAM stands for transverse rectus abdominis myocutaneous flap, the Diep Flap only takes skin and fat, sparing the woman's underlying musculature. This is important to women because taking the abdominal muscles to reconstruct the breast can be a very damaging operation in the abdominal area, creating weakness and even hernias in some instances. The Diep Flap spares these vitally important abdominal muscles and allows a woman to have a reconstruction using her own tissues without having to pay the high price of losing her abdominal musculature. Dr. Chris and I work together on these procedures because we believe it gives patients the best opportunity to have a successful procedure. These are technically demanding operations, and as such, there's not a lot of surgeons in the country who perform them. It's not a new operation. It's been around since the late 1990s. But because Dr. Chris and my training is very similar, having trained at the same institution at Johns Hopkins, our ability to perform these procedures in the operating room in a fashion that gives patients the best chance for success is vitally important to our success and our patients' success. Because of that, we also think that using two surgeons to perform these procedures allows the procedure to be done in an efficient manner where the procedure doesn't last an unnecessary length of time. So we perform all of our Diep Flap procedures using two surgeons, Dr. Chris and myself. Part of breast reconstruction is a collaborative effort between not just the plastic surgeon, but the surgical oncologist and the medical oncologist. Part of our role is to work together as a team, supporting the patient so that the patient can have the best possible outcome. We'll work closely with your medical oncologist as well as your surgical oncologist, and in some instances, a radiation oncologist, to establish the timing of each procedure for breast reconstruction so that the outcome can be optimized.